Today, we have the distinct honor and privilege of introducing a remarkable individual who has dedicated his life to saving hearts and transforming lives. Join us in extending a warm welcome to our esteemed guest, Dr. Deepak Puri. Dr. Deepak Puri, a renowned cardiac surgeon and the Director of Cardiac Sciences at MAX Superspecialty Hospital, with a wealth of expertise and experience in the field, Dr. Puri has emerged as a global authority in cardiac surgery, leaving an indelible mark on the world of medicine. Recently, Dr. Puri was awarded the prestigious title of Most Trusted Cardiovascular Thoracic Surgeon by Asia GCC, further solidifying his reputation as a trusted expert in the field. This recognition highlights his unwavering commitment to patient care and his exceptional surgical skills. His illustrious career is a testament to his excellence and innovation. Dr. Puri served as the global chairman at Cardio Merchant, where his visionary leadership revolutionized the field of cardiology. He has held significant positions throughout his career, including Executive Director of Cardiac Sciences and Director of Cardiothoracic and Vascular Surgeons (CTVS) at MAX Mohali. Prior to this, for 13 years, Sir has been Additional Director of CTVS Fortis Mohali Cardiovascular Thoracic Surgery. Dr. Puri also served as the Assistant Professor at the prestigious Postgraduate Institute of Medical Education and Research (PGI-MER) in Chandigarh. Dr. Deepak Puri's educational accomplishments are equally impressive. He holds an MCH from PGI-MER, Chandigarh, an MS in Surgery from the same institution, and an MBBS from Indira Gandhi Medical College in Shimla. He further honed his skills through extensive international training programs, including visits to Leipzig Heart Centrum in Germany, Swedish Medical Center in Seattle, and the University of Maryland Medical Center in Baltimore, USA. The recognition and accolades bestowed upon Dr. Puri are a testament to his exceptional contributions to the field. He has been awarded 8 international travel grants, reflecting his pursuit of knowledge across the globe. Dr. Puri's groundbreaking work has been acknowledged with the awards such as the Best Paper CTVS Conference, the International Health Professional Award from Cambridge, and the prestigious Hippocrates Award for Excellence in Cardiothoracic Surgery. His biography has been included in the esteemed Marquis Who's Who publication. A prolific researcher and author, Dr. Deepak Puri has contributed significantly to the scientific literature. He has published 78 research papers in international journals and authored a chapter in the book Evolution of Cardiac Surgery. Dr. Puri's expertise has been sought after globally, and he has been a speaker at 124 national and international conferences. As the organizing chairman of numerous conferences, he has played a vital role in advancing the knowledge and understanding of cardiac sciences. Dr. Puri's commitment to excellence extends beyond his professional achievements. He is actively involved in several prestigious organizations, including the Indian Association of Cardiovascular Thoracic Surgeons (IACTS), the Asian Society of Cardiovascular Thoracic Surgeons (ASCVTS), and the Society of Thoracic Surgeons (STS). As the Vice President of the Chandigarh Surgical Society and the formal national convener for CTVS Stem Cell Society of India, Dr. Puri continues to make a significant impact on the field through his leadership and dedication. Specializing in off pump beating heart bypass in high risk patients, minimally invasive and cosmetic incisions for cardiac and thoracic surgeries, vascular and endovascular surgeries, as well as the applications of stem cells in heart failure, Dr. Deepak Puri's expertise transcends traditional boundaries. His contributions to the field have been recognized with prestigious awards, including the Pride of Nation 2020, Indian Icon 2021, and the Golden AIMS Award for Excellence and Leadership 2022. We would also like to extend our congratulations to Dr. Deepak Puri on his recent recognition as the most trusted cardiovascular thoracic surgeon by Asia GCC. This accolade reflects the trust and confidence placed in him by colleagues and patients alike. Today, we are privileged to have Dr. Deepak Puri grace our channel. His invaluable insights and remarkable achievements will undoubtedly inspire and educate us all. So, without any further delay, let us dive into this enriching conversation with Dr. Deepak Puri. I welcome you, sir, to the show.
Good morning. Thank you very much, Sonia. Thank you so much.
Sir, could you share with us some of the groundbreaking advancements or techniques you have pioneered in the field of cardiac surgery?
Honestly speaking, I would not claim to have any groundbreaking advancements or techniques, but I have modified the techniques and made them simpler and utilize them to give better outcomes with minimum assistance and made them cost effective also. And I started a global group which is Trust, known as Cardiomersion, and we started it in 2011 to promote integrated approach for comprehensive management of uh, cardiovascular diseases, and we have achieved quite good results by utilizing the best out of all the advancements, and we utilize them in an integrated way so that it can benefit the patients. So not only the cardiac surgeons, the cardiologists, cardiac anesthetists, and other specialties like nephrology, pulmonology, and dietetics, and all the other specialties like physiotherapy, we come together and we promote comprehensive management. That means we start from primordial prevention, primary prevention, then early diagnosis, and then the basic medical management, and after that, if needed, then interventions, and after interventions, rehabilitation, and after that, secondary prevention, so that the patient gets the best benefit out of whatever treatment we are giving to the patient. And we also promote the awareness that most of the disease, almost 80% of the complications, they are preventable. So if we take action in proper time, then we can prevent most of the complications.
Great, sir. Very good. As the Director of Cardiac Sciences, what are some of the challenges you have encountered in your role, and how have you overcome them?
The most challenging thing that we face nowadays is that, especially among Indian population, that young Indians, they are getting affected by heart disease, especially heart attacks and heart failure. So if you compare with the Western world, Indians are affected by heart attacks at least 10 to 15 years earlier than the Western counterparts, and this has worsened after the COVID pandemic. So now many studies have shown that in the age group 24 to 44, there is a dramatic increase in fatal heart attacks after COVID onset. And also we have seen that the patients in India, they come to the hospital to seek medical management or interventions much later. So that is one of the main reasons that most of the patient of heart failure, they are residing in India, and most of them they have heart failure because they come late after a heart attack, and by that time the muscle is mostly damaged. So
Oh,
the two most important problems that we are facing nowadays are heart attacks in young and heart failure. Plus, I would also like to add some light on the other issues like there's too much emphasis on cost cutting nowadays, but it should not lead to quality cutting. And also, we have to make the treatment uh, affordable by all the patients, and we have to make best utilization of the advancements also. So we have to make a very judicious use of the procedures. We have just not to recommend all the advanced procedures to each and every patient,
right.
because it may actually be harmful also.
Mm. Sir, with your extensive experience in off pump, bypass, and minimally invasive surgeries, could you elaborate on the benefits these approaches offer to high risk patients?
Definitely, off-pump surgery has improved the results of uh, critically ill patients with heart attacks and heart failure. And we have been operating patients with low pumping as low as 15% or 20% with good results. And if we perform the surgery in well in time, and if we give the guideline directed medical therapy also, then the outcome of the patient not only improves immediately after surgery, but also the long term outcome is much, much better.
Right, right.
And the side effects of using the pump in such patients,
Actually,
like the renal complications and the neurological complications, they are less, and the patient require minimum inotropes, and most of the patients are getting discharged after 3 or 4 days after surgery. So we have experienced very good results with the properly performed off-pump surgery in such patients.
wonderful. Dr. Puri, stem cell applications in heart failure have demonstrated tremendous potential. As a leading expert in the field, could you share your insights on the future prospects and potential advancements of stem cell therapy in the medical profession?
Actually, I would not claim to be a leading professional in this field, because this is just a evolving field, and most of the whatever knowledge we have, that is based on research only, and still it is not available for application to the patients outside trials. And the stem cell for the last 15 years, we have been following the advancements, and initially people used to use embryogenic origin stem cells, and later on then bone marrow origin stem cells, and then skeletal muscles were used, and
Right.
adipose tissue stem cells were used. But later on, it was found that the basic effect of stem cells is because of the paracrine effect. And nowadays, like a lot of research is going on the use of extracellular vesicles. So instead of using the cells, if we just use the vesicles which have the messenger RNA and the microscopic RNA, which can produce the same results which we were getting from the stem cells without the risk of immune responses, and without using the cells actually, because when we used to inject the cell into
Right.
the body, like either initially they used to inject through the IV route, and later on through the intravascular during the
Right.
coronary angioplasty, and also during surgery around the infarct. But these stem cells, they usually don't last there for long, and most of them, the dwell time is very low, and they die because there is no blood supply in the dead tissue.
Right.
And to create angiogenesis, as well as to replicate the cells, Then it was tried that we can culture the cells in the labs, or we can use some sort of support for nutrition, which can keep the cells alive.
हाँ जी.
But all those studies, they though produced promising results, but they are still not now available for application to the patient.
Okay.
So nowadays the focus in shifted towards the regenerative therapy, the gene therapy, and the extracellular vesicles, which can be used to produce the same effect of angiogenesis and myocardial cell proliferation, so that we can regenerate the dead heart muscle and make it do the contractile action also, and the electrical current generation action also, because both the functions have to be done uh, similar to the way the original heart muscles are performed.
Good, very good. Dr. Saab, you have been actively involved in organizing and speaking at numerous national and international conferences. Could you share a memorable experience or an impactful presentation that has had a significant influence on the field?
I can share my own experience that working in corporate hospitals where there is no support for academics.
हाँ जी.
So initially, when the first time I went to present my work in New York, I had to sell my car and buy the ticket. And when I reached there, I had just got a credit card, and I had requested for a credit card for at least 2 lakh rupees. But when I reached there, on reaching the hotel, they told me that quantity is insufficient. So then probably the man who made the credit card, it was only worth 25,000 rupees.
Okay.
So I was stranded at New York at that time. There was no Facebook, there was no WhatsApp, so I didn't have any contacts there. And then I requested them that I have come from India and I have to attend a conference, and I have to stay there for 3 days. So then they requested their management, and they said that we'll cut the telephone connection and the internet connection, and then the quantity will be sufficient. So that is how I attended my first conference and presented my work there. And later on, like the president of the society, he acknowledged our presentation, and he was rather surprised that only two people from Asia had come to New York to present their work, whereas most of the surgeries they are done either in India, China, so Asia is doing majority of the cardiac surgeries. But most of the speakers they were from USA and they were from Europe. So I was very happy, and later on, then people started inviting me with travel grants. So that facilitated my travel across the globe. And then in 2011, there was a Asian Biennial Conference. So I was invited as a speaker there, and I had to speak on the topic is of pump passing fat. So because at that time there was controversy that most of the studies done in the Western countries, they thought that the long-term results of pump surgery they are not as good as the on-pump surgery. So at that time there was a controversy whether it will perish with time, or whether we need to go back to the on-pump techniques, or should we continue doing the off-pump surgery. So the challenging part was that the people who were sitting in the conference hall were like veterans in cardiovascular surgery, whose books we had read during our training, and who were considered authority on the subject. And like people like Brian Baxton from Australia, and then Alan Carpentier, like they were sitting there and chairing the session. And whatever I presented, my own videos, my work, and the type of surgeries we are doing, and they were contrary to the existing guidelines that were uh, at that time being followed. So it was a big challenge. And after my talk, there was a coffee break, but most of the audience and most of the like all the chairmen, they kept on sitting in the hall only, and the discussion went on for another 15-20 minutes after the coffee break.
Okay.
And later on, the conclusion was that the work that we are doing, that was like they said that it is beyond their imagination. But
Mm.
our limitation is that we don't have like facilities for research and randomized trials. So we though we were doing good work, but we did not have a comparative trial with the patients who are done on pump. We were only doing off pump, and we could not compare them with the on pump because we were not doing the surgeries on pump at all.
Okay.
So after that, like I'm very happy that
Mm.
now off pump is the preferred mode of surgery in patients with acute MI and with low
Mm.
ejection fraction, heart failure,
Thank you.
and even the American Heart Association guidelines also they acknowledge this fact. And India is considered like the leading country where off pump surgery is performed.
Mm.
And most I think most of the surgeons we are doing all the surgeries without use of cardiopulmonary bypass.
Oh.
And this has not only improved the results, but it has also made the procedure cost effective also, because the lot of equipment that we use for doing the on pump surgery is not required for the off pump surgery. But
Yeah.
you have to build up your skill, because it is more challenging. You have to do the surgery on a beating heart. And initially when we used to do, there were chances of hemodynamic collapse, and suddenly patient had to be put on pump. But and that was in the initial couple of years. But now we have been doing off pump surgery for almost 20 years, and with very good results.
Awesome. Sir, with the rapid advancements in technology such as robotics and endovascular procedures, how do you see the future of cardiac surgery evolving?
Cardiac surgery has definitely evolved a lot in the last 2 decades, and robotic is one of them. Endovascular techniques are very useful, and especially for aortic aneurysms, when we do endovascular surgery, the procedure takes hardly half an hour. And initially, we used to do long surgeries, 18 hours, 20 hours, and a lot of complication used to be there, which now don't happen. And regarding robotic, like I was lucky that I had the opportunity to observe Dr. Jonas Bonatti in Maryland, and he used to do every day two robotic bypass surgeries, and they used to do a lot of hybrid procedures.
Okay.
However, the learning curve is very long, and the procedure is very costly, and I don't see any benefit given to the patient as such, because like we are doing off pump surgery with very good results, and we also send the patient on the third post-operative day, and after robotic surgery also they used to send on the third post-operative day. But the long-term results they were not as promising. So even those people who were doing robotic surgery in US, they switched on to conventional techniques, especially for coronary bypass. But some are still using it for like mitral valve surgeries and other surgeries. And like we do a lot of video assisted thoracoscopic surgeries for lung problems, and like mediastinal tumors, and like lung resections, and mucormycosis, fungal infections, bullous lung disease, and with very good results. And I have my own technique of single port VATS, with which we have done very complicated surgeries with good results. So we have to not blindly adopt every new thing that comes, but we have to consider the pros and cons and benefits as well as risks, and then we have to tailor it according to the need of the patient, and we have to use them very judiciously.
Great. Yeah. Yes, sure. Dr. Saab, as a leader and mentor in the field, what advice would you give to aspiring cardiac surgeons who are looking to make a difference in patient care and contribute to medical advancements?
Actually, I don't claim to be a leader or mentor, but definitely I would like to advise the youngsters that nowadays very few people opt for cardiac surgery, and most of the MCH seats they are falling vacant. Almost 80% of the MCH seats they are not getting filled up every year. So in the coming maybe 5-10 years, we may face a gross shortage of cardiac surgeons because it is a very long career and a hard working one, and we have to face a lot of challenges. But I think it is a very challenging profession, and it is like very satisfying also. But we have to adopt ourselves to the changing times, and we have to get accustomed to the teamwork approach, and we have to learn how to go along with the rest of the colleagues, cardiologists and cardiac anesthetists and other specialties who play a vital role in delivering the best outcome to the patient. So it is not a one-man job. In future, it's going to be team approach all the way.
Right, right. Your research and publications have made a significant impact on the scientific community. Can you highlight a recent study or finding that you believe has the potential to revolutionize cardiac surgery?
I don't know whether anything would revolutionize the cardiac surgery, but definitely I recently presented my experience in ischemic heart failure, like the heart failure that occurs after heart attacks when the patient don't come in time and there is a delay in the initiation of the treatment. And when we do beating heart surgery in these patients, and then we use the comprehensive management, we use the guideline directed medical therapy before taking the patient for surgery and after taking the patient for surgery. And then we use a comprehensive technique where like complications like patient may have low ejection fraction, patient may be having renal issues, patient may be having pulmonary issues, patient may be having hyperkalemia. So we have to deal all the problems, and then nutritional aspects have to be taken care of. Physiotherapy has to be taken care of so that the patient has a early recovery and patient has a good immediate as well as the long term result. And when I compared my own results after starting the comprehensive management, like we found that both the short term outcome and the long term outcome has improved drastically. And those patients who used to get lost in follow up and used to come in the emergency with complications, now they are coming regularly for follow up. So it's not just that we operate and we leave the patient. We have to follow the patient throughout his life so that he can have a better lifespan and he can have a better health span also, and his quality of life remains good throughout for a longer time.
Sure, yes. Sir, balancing a successful career with humanitarian efforts can be challenging. How do you manage to contribute to society outside of your professional responsibilities?
See, I always make it a point that we are not just supposed to do the surgeries only. Like initially, for first decade in my career, I just used to do surgery all the time. But later on, I realized that by doing all these surgeries, we are not going to eradicate heart disease. So, first of all, we have to make people aware that there should not arise a situation when you need a surgery. And because most of the complications they are preventable by taking simple steps. So, whenever I get time, I spend it to spread awareness, either through arranging talks or whenever I am invited anywhere in any university, any colleges, any social gatherings or any communities. So I never miss the opportunity to give talk, especially when it is related to cardiac surgery. prevention and about like time, importance of time when there is an emergency, importance of taking the right decisions,
Mhm.
and also I make it a point that we keep on organizing conferences. In Cardiomergen, we organize every year global conferences across the globe, and with the top faculty from all the countries. Like in the recent conference, there were 21 countries had participated, and we had 79 speakers from all over the world. So we come to know about the recent updates, and we spread knowledge and awareness across the globe, so that like medical treatment should be uniform. It should not be that a person gets better treatment in Western countries and advanced countries and developed countries, and they should get like inadequate treatment in developing countries. So it should not happen. And I would be proud to say that in India, most of the hospitals they are giving very high quality care, and their results are like as good as any good hospital anywhere in the world.
Yes. Dr. Saab, what are your thoughts on the importance of collaboration and interdisciplinary approaches in healthcare, particularly when it comes to complex cardiac cases?
I've already discussed about Cardiomergen. Cardiomergen was started in 2011 when I felt the need to do this team approach and involve every specialty who is required for the management of cardiac patients, because many of the patients they suffered a lot because it was not clear that why a patient is having some complications without having a discussion among the specialties. So medical treatment was heading towards becoming tubular. Like everybody was looking after his own specialty, and we had little knowledge and little interaction with the other specialties. But we tried to change this, and the first global conference we held in 2011, there were 400 delegates, and there were 45 speakers from abroad and 55 from India, and we discussed this integrated approach for comprehensive management for the first time, and it got a very good response. And then everybody wanted that we should do it regularly every year, and we are lucky that we have been continuing to do it for the last 12 years now. And things have changed, and everybody now recognizes, like in 2011 only, American Heart Association also in their guidelines included team approach for the management of cardiac patients. And now we do a lot of complex procedures like percutaneous aortic valve implantations, endovascular procedures, and hybrid procedures. And for that, we need a team approach, and we have to work together with the other specialties. And it will make not only the outcome better, it will also improve the trust of the patient, because when you're managing as a team,
Yes,
the results are much, much better.
definitely. Dr. Puri, with such a demanding and busy schedule, maintaining personal health and fitness can often be a challenge. Could you share some of the practices or activities you engage to prioritize your own fitness and well being amidst your professional commitments?
Definitely, professional commitments get the priority, and most of the uh, surgeons in cardiac surgery they don't get enough sleep, they don't get enough time for themselves, and especially there's a need to de-stress yourself, because all the time you are dealing with patients who are really sick and who are on verge of death, and then you have to be always alert, because even a few minutes delay in cardiac surgery it can cost the life of the patient. So uh, we have to be alert all the time, and but if you love your profession, if you love your work, then you don't feel distressed. And whenever we get time, like I go for a walk, and I walk in the park, and we love music, and we have some singing also. So many doctors they like to sing and de-stress themselves. So recently we made a short movie on why youngsters are getting heart attacks. So this was nominated for two international film festivals, and I was awarded for the best director also. So
What?
which came as a surprise because we just completed the movie in 2 days, and the basic idea was to spread awareness about the value of time, because most of the people they delay the treatment after a heart attack, and also the, yeah, lifestyle and the impact of COVID, all this is having a impact on the youngsters. So I think everybody should be aware how to prevent heart attacks.
Mhm. Sir, there was a recent incident where you played a pivotal role in saving a life during a heart attack on Air India flight while you were returning from Tokyo. Could you share the details of that incident and your thoughts and emotions surrounding the experience?
Yeah, sure. I would like to share with you. But before that, I will share another incident. Like in the beginning of my career,
हाँ जी, हाँ जी.
I was just newly appointed assistant professor in PGI, and there was a patient who was a young boy who was a student. He was stabbed, and he
Mhm.
was stabbed in the upper part of the abdomen and profusely bleeding. And he came in the PGI emergency, and at that time, it was vacation period, and my seniors they were all on vacation, and I was just fresh assistant professor there, and patient needed immediate surgery, but we were not sure whether it had hit the liver or it had hit the aorta, which is the big vessel, or whether it has gone upwards towards the heart. So we just wheeled the patient to the CT room and took a few cuts after giving the dye, and the only thing we could see was that there was air in the pericardium, like in the bag in which the heart lies. So there was air inside. That means the pericardium had been breached, and then I took the patient to the operation theater, and we opened the chest, and we did the repair. There was a injury, stab had gone into the right ventricle. So at that time, if you had to do heart surgery, all the surgeries were being done on pump, and for that we had to arrange the um, all the material that was required to put a patient on pump. But as the student was brought by the other students, and there was no way like we could arrange all the things required at immediate notice. So we just took the risk of taking the patient into the OT, and I did the surgery on beating heart, and the patient revived, and patient went home. So that was one incidence which encouraged me to take initiative and do things which normally people are not doing. So we had to think out of the box when such a situation arises, and we have to use your own innovation how to move forward. So similarly, like in this, uh, after that, many times like patient they crash and we revive them. We do open cardiac massage, and we take them for surgery and do the surgery, and the patient goes home after 5 6 days. So that has become quite common nowadays. And in this recent incidents, I boarded a flight on my way back from Tokyo, where I organized the 12th Cardiomulsion Global Conference, and the flight started at 11:30, and at 2 o'clock there was an announcement that patient is not well. So
Right.
I rushed to help them, and we saw that patient was having chest pain and sweating, and the history that patient was diabetic also. He had a recent COVID infection also, and suspecting a heart attack, then we gave him sorbitrate tablet which was available on the flight, and um within few minutes patient crashed, and immediately we put him on the floor of the aircraft and started cardiac massage, and he was pulseless and there was no respiration, and we kept on doing the cardiac massage, and luckily we were able to revive him. And
Okay.
after that, like we checked from the crew that we were over the sea, and nearest land was either China, or for reaching India, it would have taken 5 hours to reach Calcutta. The flight had to be diverted, so I took the decision to divert it to Calcutta because I was not sure whether I could arrange quickly the angioplasty for this patient there. So I prefer to go to Calcutta, although it would have taken 2-3 hours more.
Mm.
But we tried to keep the patient stable all that time. Then we reached Calcutta. He was immediately, the ambulance was ready, and we shifted the patient to nearby cardiac center, and angiography was done, and LAD artery, which was left anterior descending artery, which was totally 100% occluded, was opened up, and patient survived. So it was a really like challenging experience, and
Definitely.
with the help of the aircraft crew and the captain, we were able to save the life of the patient.
Wonderful, wonderful. Dr. Puri, as a highly esteemed cardiac surgeon, your expertise is definitely invaluable, especially in critical situations. What would you advise to a common man if he or she they experience a heart attack or somebody else is experiencing? What actions you would recommend to provide immediate assistance and potentially if life can be saved?
The most important thing is time, because whenever your artery is blocked, your muscle of the heart is not getting the blood supply. So every minute is crucial, and every minute of delay will reduce the number of years you are going to live later on.
Mm.
So first hour is very crucial, known as the golden hour. And most of the people, what mistake they do is that they like they think that this is not a heart attack, this is maybe indigestion or some gas problem, and they start taking antacids,
Yes.
and they start taking like local remedies. And
Mm.
because of this, there is a delay in the patient reaching the hospital and seeking treatment. So, if the patient doesn't reach the hospital within 1 hour, and if the artery is not opened up immediately, the
Mm.
muscle will start dying. So, if the artery is not opened up within 6 to 8 hours,
Right.
then there will be a permanent damage. And even if the patient is saved because of the aggressive treatment later on,
Mm.
this patient will remain a patient of heart failure for the rest of his life,
Mm.
because some part of the muscle will be already dead. So
Mm.
most crucial thing is that whenever there is any pain or discomfort above the level of umbilicus,
Mm.
even in young patient nowadays, we should keep the first possibility of heart attack. And
Okay.
once the heart attack is ruled out, then only you should treat it as a muscular pain or maybe acidity or anything else. But first we have to be very sure this is not a heart attack,
Okay.
because many patients, they may even not have the classical symptoms. Some
Mm.
patient may just have sweating, some patient may have just some discomfort in the upper part of abdomen, and many patients may be just having a feeling of like uneasiness or some compression in the chest. Some patient may have pain in the upper part of neck or jaw, or maybe shoulder, or maybe arm. And especially women, they don't have classical symptoms, they may just feel a little weak, and there
Mm.
may be some sweating, or there may be a headache,
Mm.
and some feeling of being unwell.
Mm.
So most of the patient, we must understand that the diabetics and female population, they usually don't have classical symptoms, and almost half of the men also, they don't have classical symptoms. So first we have to rule out heart attack and get immediate attention, go to a hospital which has cardiac facilities, and get ourselves evaluated. But if cardiac facility is not available nearby,
Yeah.
then we have the option of getting thrombolized. So some medicine is injected into the blood, which can dissolve the clot. So after that, uh, we gain a few more hours and little more time so that the patient can be safely shifted to the nearest place where the cardiac facility is available. So the most common mistake that people do is they go late or they shift a patient even if the nearest cardiac hospital is several hours away. So some patients they die on the way. So both the things they are not to be done. And if we take proper care and if we get treatment well in time, and then most of the patients can be salvaged and we can have a normal heart function even after a massive heart attack. And above all, 80% of these heart attacks they are preventable by simple steps. So everybody should adopt preventive measures first.
Definitely. Right, sir. Sir, we sincerely appreciate your visionary leadership, commitment to research and education, and relentless pursuit of advancements in cardiac care. Your contributions to the medical community and life saving interventions, such as the recent intervention during a heart attack on flight, demonstrate your unwavering dedication to the betterment of patient lives. Once again, our warmest thanks for sharing your expertise, passion, and experiences with us today. We are honored to have had this opportunity to learn from you today. We wish you continued success in all your future endeavors and look forward to witnessing your continued impact on the field of cardiac sciences. Thank you, Dr. Deepak Puri, for being an extraordinary healer and a true inspiration. And thank you, sir, for
Thank
being.
you very much for being so motivating. And definitely, we will try to do our best in future also. And we would like to give the best care and best services to all the people all over the globe.
Right. Thank you, sir. Thank you so much.
Thank you.